Welcome, Internet. Today we're going to do something very, very different. I'm not going to be talking about a concept, a theory, or a model of psychology or psychoanalysis, and I'm not going to be talking about a mental illness or psychopathology. Today I'm going to be talking about the French mental health system, and notably through the institutions, because it's been decades since the French have invested into them, meaning that right now we are living off what was done in the 70s. And when I mean living off, I'm being very generous. It's more like we're surviving on those types of models. And the funding is being reduced and cut slowly but surely. So to give you a point of comparison, in my institution where I work part-time, because I work part-time in a practice and part-time in an institution, the institution I work with, which was created in the 70s, when that was created, it had psychologists, psychiatrists, nurses, educators, and psychometricians. Now we are virtually 50 years later. Only psychologists and educators are left. Now, I wanted to talk about this because this has been on my mind for a very, very, very long time. French mental health care, I was going to say psychiatry, but psychiatry is included in my definition of mental health care, but this mental health care has become appalling and it is untenable. It is untenable because what is happening right now is that this defunding is still continuing, it's still ongoing. It's still basically happening as I'm talking. And how it proceeds is that, for example, right now in a lot of institutions, like the one I work in, there are, for example, no more medical doctors, psychiatrists that could help, could prescribe medication, that could guide teams in how to handle a situation on a biological level. So we don't have those professionals. So when the patient has those needs, we have to invite them, help them to go and find the needs in the external environment, be it a private practice, be it another institution. But, and that's the big but, in that other institution there might be a psychiatrist, yes, but that psychiatrist is going to be seeing an ungodly amount of patients per day. For example, he could be seeing any number of patients between 15 and 30 per day. So when you see that amount of people, the sessions are going to be 5-10 minutes long, so you don't get that psychotherapy aspect of it. So this is where often, before at least, psychologists came to reinforce that they were the ones doing the psychotherapy of the patients. However, this is also being cut back upon. That now the institutions are deliberately asking no more psychotherapy because it is too long and expensive, and that we need to treat people in blocks rather than individually. Like it has to be like a Gatling gun, right? Everything has to go top speed because there's just that many demands. Because what has been happening is that there's been a defunding, yes, but an increase in the need for mental health professionals. And we are at the point where fundamentally in institutions, we, the mental health professionals, and even all professionals that work in institutions, let me be very clear, it's everyone. It's not just psychologists, psychiatrists, it's also the nurses, it's also the educators, it's also the physiotherapists, it's also everyone that has anything to do with health in general is being overworked nowadays in institutions. This is due to the fact that there is less and less people doing it and more demand. So you're gonna be spread super thin. And this is where the real fundamental problem is that because there's a push of the government, the French government, to defund those institutions in what I would call a very, very insidious way, because it's not about like cutting like that. It's just once someone leaves, for example, let's say you have a psychologist that leaves an institution, well, you're not going to renew the contract. The job's gone. And that is how institutions lose professionals, because things are not being renewed. Because at the top, basically, they don't see what's the point. Because if, let's say, you can send a person in a private practice, well, then you don't need a indoor psychologist in the institution. You just send them away. But by doing so, you also deprive the institutions of the tools that they could use to help someone. And this is evident in the case of psychiatrists, as virtually no institutions nowadays in France have them. It's relatively rare if it's not directly a health institution. Like if it's just a social institution, it's very rare for them to have a psychiatrist at all. And even if they have a psychiatrist, they're going to be overworked, and often they're only part-time there. They might be there 1 day a week. So you see, you can't really do as much as if you were there at full time. And it's true for a good number of institutions that the professionals are there, but they're there sporadically or they're not there at all. So it leads to a massive problem, because mental health needs haven't decreased. They've increased. And since COVID, they've increased dramatically. That increase in demand, in needs, is not met. And it's deliberately not met by the government, because they know what is happening. So their solution, what they want to do, is to deviate the needs of the patients in the private sector. So what are they going to do? They're basically refunding certain types of sessions. And you might say, well, that's great. People get the care that they need. Yes and no. Like, yes, for some people it might be enough. Right now it's 12 sessions. Might be enough for certain people, but not for most. Not when you have severe mental illness. So severe, and even then, severe mental illness is not treated with the respect that it is due, because of the defunding of institutions. People can't go there anymore, or if they go there, basically it's like a Gatling gun. It's in and out, and you don't take the time to take care of them. Or they can't even go into private practice because it's considered too severe for a private practice. So there's no respect for those people. There's no attempt at trying to help them. This is why it's a disaster. It's because we're cutting everything and we are creating nothing. We are just trying to use, instead of fixing the leak, what we're doing is just putting a bucket under a previous bucket to try and avoid the impacts of the leak. But we're not fixing anything. We're not improving anything. We are just letting the system perish. And as it is perishing, it's putting stress on all professionals that still want to do their jobs well. I have yet to meet mental health professional that's completely cynical and doesn't care. Often we do care a lot about people, but in a system like that, in which we are understaffed and overworked, there's going to be a breaking point. And when that breaking point happens, well, you're not necessarily replaced, which means that there's a lack that remains, and it's even worsened. And this has led to massive problems. A couple of weeks ago, I was at a conference in which a psychologist came forward and stated that in her institution, she was explicitly asked to no longer provide any therapy because it was too costly, too expensive, and it was not quick enough. And this was unfortunately just commonplace. No one was surprised, no one was shocked, no one was just flabbergasted by what she was saying. Everyone was like, this is the world we live in. And this is why it is so appalling, is that fundamentally we all know what's happening, is that the institutions are breaking down and the private practices aren't going to be able to replace them, not to the fullest extent, because when you work in a pluridisciplinary team, a team filled with many types of different professionals, you get a wonderful amount of healthcare because everyone can help. But if you're going to mix match everyone, first and foremost, a person might not even go to see certain types of professionals, but, and this is even more worrying, you don't get the full side of the spectrum. You don't get many people discussing ideas and treatments and how things would work out. And that discussion might not seem like much, but it is enormous because it allows the person to be in the hands of many people, of an institution, of a collective. And we don't get that in private practices. We don't get coterie of professionals. It's very rare. Often we are isolated in professional practices in a way that institutions create a collective, a dynamic that is invaluable because it helps people so much, but we are losing that and more. And what's becoming very frightening is that in France we are a healthy number of psychologists. There's a lot, and I think we are the first country of Europe in terms of numbers of psychologists, right? And we always were, easy to recruit because there's so many of us, so institutions had no problem. Right now, because of the system, because of the way it is, our numbers in institutions are starting to dwindle as people don't want to go there anymore. People don't want this pressure, this suffering, when they can work in a private practice at their pace, with the patients, with the care, the level of care they want to give. Whereas in an institution, you're pressed by time, therefore you can't give the level of care that the patient should receive. And this is why everything is collapsing. It's because the only thing that obsesses the government or that they have in mind is the cost cutting. Cost cutting. That's the only thing that interests them. What is happening in institutions, or what is not happening because of the lack of professionals, because of the lack of time, because of the lack of finances, does not interest them. Quite the opposite. They only see the money that they've saved, at least superficially, because we all know that people that are suffering psychologically are going to have an impact on the economy. Like people that suffer so much that they can't work has an impact. People that suffer so much that they stop consuming because they just can't go forward. People that suffer so much that the families have to stop working to take care of them. All of these situations have a brutal impact on the economy, and we know for a fact that having strong institutions helps the economy. And yet, we are in a neoliberal model in which collective institutions don't have their place anymore. And this is appalling. It's been decades since all of this has been just completely broken down. And we are now at a point where in all institutions, at least the ones I know, the ones in which I've had an echo, I haven't heard one single institution that doesn't lack at least one professional. There's at least one professional that they can't recruit, and that's at least. I have heard institutions that have dozens of employees that they can't recruit. And I think that this shows how appalling it is, that we have real demands, we have to help people, and yet we can't. We can't because the system is not designed to help. It's designed as a Gatling gun, where it's speed and it's just in and out as quick as possible. And this terrible vision is something that I wanted to talk about, not because it's going to help. This video is there to explain to you the French mental health system. It's not there to find solutions, because no one that watches this can have an impact. And it's not the fault of any one of you watching this video, nor is it my fault, nor is it anyone's fault, if not the fault of the way the system thinks. And sometimes people in the system want to change it, but they can't, because we're so entrenched in this neoliberal fantasy that no one can change it at present. We need collectively the world to change systems, and God knows that's gonna be a tough sell if it can ever be sold in the first place. But why I wanted to talk about it was to share this form of daily activity, this dread that is now happening in institutions, in the fact that, well, right now we don't, as psychologists, we are asked not to provide psychotherapy. We are asked to do things fast, and sometimes we are not even asked to do like CBT. It's not even that. Sometimes just like talk to the patient, tell them that he can go better, and tell them everything's transient. I mean, what kind of care is that? It's not care. It's just like a task that you tick on a box. I mean, it's that bad. And I wanted to talk about it because I feel it's important to not deny the reality of what is happening. But I think that there is also some level of hope, as people that go in private practices are not going to be able to substitute for institutions. But I have met a lot of passionate people, and I think that as long as our collective drive to help remains, that perhaps we can organize, and that's me daydreaming, but still, we can organize enough to be able to save our institutions or recreate them. Because I mean, it's not about necessarily saving the old or preserving the old institutions, but we can recreate something, we can make something new that can work in the same fashion. Because I really do feel that collectively, professionals, many professionals, for one person, can have a fundamentally positive impact on the individual, more deep and more profoundly than just one professional in a private setting. And of course, private settings are wonderful and they provide people with a lot of things, but people that are severely regressed, like psychotics, like, for example, people with intellectual disability, are going to be much more helped by institutions than a private practice. At least that's what I've seen in my experience. So that's pretty much it. I'm sorry it's quite of a downer video, but it's still the reality and I wanted to talk about it. Hope you found it interesting, and I'll see you in the next one.